life-threatening diseases like herpes simplex, hepatitis B, polio, rabies, malaria, mumps, viruses related to organ transplantation, rejection, and more.
Now Mickey will be cross-examining Kate.
How do you know that all transplants first performed on chimps will be successful in humans?
Of course, I'm not positive that all transplants will be successful on humans just because they worked on chimps first, but since they have the closest genetic makeup, I'd say it's worth a try. It could be very helpful if performed correctly.
How will animal experimentation be monitored to make sure the only time it is done is when it's completely necessary?
As I stated before, according to the New York Times, the National Institutes of Health suspended all new grants for biomedical and behavioral research on chimpanzees and accepted the first uniform criteria for assessing the necessity of such research. Those guidelines require that the research be necessary for human health and there be no other way to accomplish it. So there will be laws and close monitoring at hand by the government.
You mentioned gene therapy. What does this have to do with the effects of experimentation?
Gene therapy is just one benefit that we can gain from cloning and experimentation. It is something that can lead to greater advances in animal testing as time goes on.
Courtney will be presenting the second negative construct on why animal experimentation is inhuman.
Lindsay made a good point earlier by stating that animal research is considered a last resort, to be used only when there is no alternative method. She also claimed that it is possible to experiment on animals without being cruel. I will address the fact that animals have the right to be treated as beings of value in themselves, not as the means to human ends. According to the Medical Research Modernization Committee, the general public, which cares about animal welfare, has been led to believe that animals rarely suffer in laboratories. In practice, as everyone knows, animals are not routinely treated well by animal experimenters. Apart from the fact that millions of animals die each year in experiments, others are often not adequately anesthetized and are abused by handlers and experimenters. American Medical Association 1988 states animal experimenters often cite U.S. Department of Agricultural statistics derived from researchers themselves, which claim that only 6 to 8% of animals used in animal experimentation experience pain unrelieved by anesthesia. U.S. Department of Agriculture 2002 Farm Bill Amendment, however, states that mice, rats, birds, in the United States constitute over 90% of all animals used in animal experimentation, receive absolutely no protection from the Animal Welfare Act. People for Ethical Treatment of Animals, PETA, declares that mice, rats are forced to inhale toxic fumes, dogs are force-fed pesticides, and rabbits have corrosive chemicals rubbed into their skin and eyes. Many of these tests are not even required by law, and they often produce inaccurate or misleading results. Even if a product harms animals, it can still be marketed to you. Cruel and deadly toxic tests are also conducted as part of massive regularity testing programs that are often funded by U.S. taxpayers' monies. The Environmental Protection Agency, the Food and Drug Administration, the National Toxicology Program, and the Department of Agriculture are just a few of the government agencies that subject animals to painful and crude tests. I will now address the fact that there are actually few breakthroughs that have been made as a result of animal experimentation. The main source of medical knowledge has always been the direct study of human disease by closely monitoring human patients. According to Raines' 1991, proponents of animal experimentation, tests, experiments, and educational exercises involving harm to animals claim that it has played a crucial role in virtually all medical advances. However, several medical historians argue that key discoveries in such areas as heart disease, cancer, anesthesia, and psychiatry were in fact achieved through clinical research, observation of patients, and human autopsies. For example, cardiologist Jean Ornish has demonstrated that a low-fat vegetarian diet, regular exercise, and stress management can reverse heart disease. Similarly, Caldwell Esselstyn has shown that lowering cholesterol levels while plant-based plant-based diets and medicines as needed arrests and often reverses heart disease. Henry Heimlich has relied exclusively on human clinical investigation to develop techniques and operations that have been saved thousands of lives, including the Heimlich remover for choking and drowning victims, the Heimlich operation to replace the esophagus, the throat tube, and the Heimlich chest drainage valve. Taylor Robinson, 2001, Savory RL 2001, and Pirker CM 1991 all agree that modern non-invasive imaging devices such as CAT, MRI, and PET inspect scans have revolutionized clinical investigation. These devices permit the ongoing evaluation of human diseases in living human patients and have contributed greatly to medical knowledge.
Kate will now cross-examine Wood.
By saying you disagree with our statement that animal research should be considered as an alternative method, and by are you implying that if need be, we should experiment on humans rather than animals?
The application of this principle means that animals should never be experimented upon whatever the potential gain of humanity. To infect monkeys with AIDS virus or to expose rodents to toxic chemicals and radiation is simply not acceptable, whatever the supposed benefits. Furthermore, there are alternatives to many tests that are currently being done on animals. Example, growing tissues or cell cultures from human cells in a laboratory.
How can you say that there are few?
Because its advocates have overstated its achievements. There have been a catalog of errors and failures in animal testing, which its advocates gloss over. As many as half the drugs that have been approved in the US and the UK after animal testing have subsequently had to be withdrawn because of harmful side effects.
How can everyday people make a change in the testing of animals?
PETA suggests that we demand that our alma mater stop experimenting on animals by buying cruelty-free products, by donating only to charities that don't experiment on animals, by requesting alternatives to animal dissection, and by demanding the immediate implementation of humane, effective, non-animal tests by government agencies and corporations.
We will now attempt for both sides to rebuttal. The affirmative side will rebuttal their arguments first.
Based on our evidence, we have won this debate based on our evidence in support of our major points. As we have stated earlier, before animal experimentation begins, it needs to be determined as the only and best option. Each is based on a case-by-case basis. Like I stated earlier, both the potential scientific and medical benefits of the research and the possible suffering of animals used are weighed up carefully before any animal research project can proceed. The case is determined based upon a set of rules. There have been special controls on the use of laboratory animals in the UK since 1876. These were revised and extended in 1986 as part of the Animal Scientific Procedure Act. This law safeguards laboratory animal welfare while allowing important medical research to continue. These controls are widely regarded as the strictest in the world. These controls will also ensure that animals will only be used if there is a likelihood of important medical advances to result. Under the same act, certain procedures need to be followed while following strict licensure to be sure that the animals are not treated in a cruel fashion. According to the site, animal procedures can only take place in research institutes or companies which have appropriate animal accommodation and veterinary facilities and have been granted a certificate of designation. This also includes that the individuals conducting the experiment hold specific licensure. To continue, if the experimenting were to be discontinued, medical advances would come to a halt. Animal research has played a major role in developing improvements in human health. This has been proven in earlier evidence, although evidence through the countless advances. Furthermore, as Catherine stated in the article titled Animal Testing, Pros and Cons, human beings share about 99% of their genes with chimpanzees and only slightly fewer with other monkeys. As a result, the reactions of these creatures are a very good guide to possible reactions of human patients. Cloning and experimentation can also be helpful in the medical aspects of both humans and animals. In conclusion, animal experimentation can be in the interest of animals as well as humans. If we did not test certain things on animals, we would not be able to have medicine for the animals either. No matter what, animals will never be able to give their consent. In all, animal testing should not be banned because it has great benefits and could continue to help in experimentation advances as well as medical advances in the near future.
Thank you, Lindsay. Now the negative side will rebuttal.
According to Balcom, animal laboratories are not necessary for teaching biological and medical principles and skills to medical students. And 85% of U.S. and Canadian medical schools have eliminated animal labs from their educational curriculum. Effective alternative teaching methods include lectures and written course materials, videos and interactive virtual reality programs, mentored patient care encounters, in surgery participation, and lifelike programmable interactive patient simulators. Comparative studies of simulation technologies for many aspects of medical education. Examples include anatomy, physiology, pharmacologically, surgical skills, trauma management, and invasive procedures. Have repeatedly demonstrated superior training outcomes, fewer patient complications, greater training acceptance, and more efficient use of educational time and resources. According to Grape 2004, proponents of animal experimentation, test experiments, educational exercises involving harm to animal, claim that it has played a crucial role in virtually all medical advances. However, several medical historians argue that key discoveries in such areas as heart disease, cancer, anesthesia, and psychiatry were in fact achieved through clinical research, observation, patients, and human autopsies. According to the Medical Research Modernization Committee, the general public is clearly uneasy about animal experimentation. In a 2006 poll in the United Kingdom, for example, 51% of nearly 1 million voters said they are not in favor of animal testing. Since medical research is conducted for the benefit of the public and is financed largely with their taxes and charitable donations, their concerns should be respected and addressed. The tens of millions of animals used and killed each year in American laboratories generally suffer enormously, often from fear and physical pain, and nearly always from the deprivation inflicted by the confinement, which denies their most basic psychological and physical needs. The value of animal experimentation has been grossly exaggerated by those with the vested economic interest in its preservation, because animal experimentation focuses on artificially created pathology, involves confounding variables, and is undermined by differences between human and non-human anatomy, physiology, and pathology, and is an inherently unsound method to investigate human disease processes. The billions of dollars invested annually in animal experimentation would be put to much more efficient, effective, and humane use if redirected to clinical research and public health programs. This evidence, along with the evidence that Mike and I presented earlier, exemplifies why we should win this debate. Thank you.
Throughout the debate, you have heard each party make valid points about this controversial issue. The affirmative raises points about animals like chimps being the closest genetic makeup to humans and should be used for testing, setting high standards that are followed regarding animal suffering, which are among the strictest in the world, and allow medical research to be continued. The negative has stated that animals have the right to be treated as human beings, feeling both physical and mental pain, and that there's been few breakthroughs as a result of animal experimentation. Thank you for listening to our debate about whether or not animal experimentation should be continued. Does anyone have any questions for either side of the debate? All right, well, thank you all for coming. Nobody has any questions?
Hold your seats for just a quick second. Thank you, everybody, for coming out. I'm just doing a scan of the audience. Thank you.